in the male reproductive organ can be divided into external organs and internal organs. Now, in the external organ, which we can see from the outside, those are the primary gland or the gonad, that is the testis, which is the analog of ovary in case of female. And testis is placed within a scrotal sac. Nature has placed the testis in the scrotal sac purposefully to enjoy a colder temperature, because if it is placed within the abdomen, the temperature is definitely higher than the scrotal sac, and there what will happen? The spermatogenesis process, sperm means seed, genesis means generation. So generation of the sperms will be affected. The optimum temperature which is needed is absolutely present in the scrotal sac. So testis along with the scrotum and the male organ of copulation, that is the penis, is present, which we can see from the outside. And there are other organs which we cannot see from outside. They are internally placed, like prostate gland, like vas deferens, like seminal vesicles, bulbourethral glands. They are the other organs which are present. And now in this figure we can see one tubular channel is coming out from the lower pole of the testis, and it goes upwards. It enters through the superficial inguinal ring, and then it traverses the deep ring along with other structures of the spermatic cord, and you can see it traverses the abdomen, it traverses the pelvis, and ultimately it hooks medially. In the previous slide we can see it hooks medially the ureter at the base or the posterior surface of the urinary bladder. The pink one is the urinary bladder, and behind the urinary bladder there is we can get the trigone of the bladder, external trigone, where we can see this tubular structure or the vas deferens or the ductus deferens. It joins with another duct which is coming from another gland which is called seminal vesicle, and ultimately they form the ejaculatory duct which passes through another gland, that is the prostate gland, that is again a part of the internal genital organ, and ultimately it opens in the prostatic urethra. In the prostatic urethra it's open, and it ultimately it ends here. So that is the ductus deferens. Now We can also find in the posterior part of the testis, there is a comma-shaped area. Already you know, you should have some idea about this structure. This is nothing but epididymis. Comma-shaped area. It is coming from upper pole of the, we can see upper pole of the testis. It is coming down. It has got head, body and tail. And the tail is continued from the lower pole as the vas deferens or the ductus deferens. Next. So already I have told you these are the structures of the external genital organ of male. Another thing, here we can see, what you can see? You can see the urinary bladder. You can see the urinary bladder. And behind the urinary bladder, we can see the tubular channel, which is nothing but the ductus deferens, which joins with this duct of the seminal vesicle. Ultimately, we are seeing that ejaculatory duct, and ultimately it opens in the prostatic part of the urethra. The urethra has got different parts. When it passes through the prostate gland, it is called prostatic part. When it passes through this area, this is called the membranous part. That means the perineal pouch. Within the deep perineal pouch, that is the membranous part. And next is the penile part. Okay. So ultimately it opens through the external aperture or the external urethral orifice. Next. Now, this is the passage of the spermatozoa. Spermatozoa is produced inside the seminal vesicle of the testis. I will show you the details of the seminal vesicle of the testis. Okay. From where it is carried out through the efferent ductules. I will mention what are efferent ductules. Actually, there are straight tubules. From there, it enters into the efferent ductule. And efferent ductules, actually, they form the head of the epididymis. Then the body of the epididymis. Then through the tail of the epididymis. Ultimately, it enters into the vas deferens or ductus deferens. This is the channel through which the sperm actually moves up to the prostatic urethra. Okay. So, it joins with the ejaculatory duct and it is discharged in the prostatic urethra. The male external genital organ, there is the penis. Penis has got several parts which has got dorsal surface, ventral surface. Which surface we can see? This is the ventral surface, and which is on the other side, that is the dorsal surface. Penis has got the two muscular component, that is which is continued from the crus of the penis on either side, and within the crus, which is continued as above as corpus cavernosum, and the bulb of the penis in the root we can see, which is continued as corpus spongiosum. Within the corpus spongiosum we get the penile urethra. Okay. Now these three structures actually forms the penis. Okay. But I will not go through in detail of the penis today. Okay. I will just start with the the main, the primary sexual gland, that is the testis. It is already, it is placed, I have told you that it is placed in the scrotal sac. It has got, what is the shape? It is elliptical in shape. Okay. It has got upper pole and lower pole. It has got antero-inferior surface border. The border which is present, that is called anterior or antero-inferior border. And we can see another border posteriorly, which is, if there is anterior border, there should be a posterior border. That is called posterior-superior border. The surface which we can see, that is the lateral surface. Why it is lateral surface? We can see a depression between the epididymis and the testis, which is called the sinus of the epididymis. Sinus of the epididymis. So that is the lateral surface. So if there is a lateral surface, another surface which we cannot see, that is the medial surface. So upper pole is directed upwards and laterally. Upwards and laterally. And lower pole is directed downwards and medially. So there is, the testis is inclined. It remains inclined within the scrotal sac. Axis is passing downwards and medially. Okay. Now, in the lower pole, the testis is attached to the epididymis with a fibrous strand. Okay. In the lower part, it is attached to the, you can see there is the inferior ligament of the epididymis. So, there is a fibrous strand which attaches the testis with the lower part of the epididymis. Upper pole, lower pole, antero-inferior border, posterior-superior border, lateral surface, medial surface, and inclination. It is elliptical. It has almost 2 inches in length, 1 inches in breadth, and around it just more than 1 inches, that is the breadth, that is around 3 centimeters, that is from anterior to posterior part, that is. So this is, and what is the weight? You can see it varies, 15 grams or like that. Now it is position, it is placed within the scrotal sac. Next. So next slide. Lower pole, posterior. Already I have told you all these things. Now this is the interior of the testis, which also shows the different coverings. Actually, during embryonic period, testis is developing in the dorsal wall of the abdominal cavity, from where it is being dragged through the deep ring, then superficial ring, and ultimately it reaches to the scrotal sac with the help of gubernaculum. Okay. So gubernaculum not only drags the testis, also it drags the peritoneal sac, which is called the processus vaginalis. And throughout the channel, that means deep ring, superficial ring, throughout the channel, actually the peritoneal sac moves and ultimately reaches the scrotal sac. And the distal part of that processus vaginalis remains patent, and rest of the part degenerates. And this part which is present, the distal part which remains with the testis, that is called tunica vaginalis, the processus vaginalis, and it is called tunica vaginalis. What we can see, there are two layers of tunica vaginalis, like our pleural cavity, like our pericardial cavity. We know there are visceral layer and the parietal layer. So here also we can see one layer is intimately attached to the testis, that is the visceral layer, and that is reflected from above and below. You can see that is a reflection, reflected as parietal layer, and ultimately it is reflected up to the lower pole, upper pole to lower pole. That is the parietal layer of the tunica vaginalis. Okay, and the cavity we can see, that is the cavity of the tunica vaginalis. The next one is white layer. That is the tunica albuginea. Albinism, that means white. The next layer is fibrous layer and white in color, so it is called tunica albuginea. It is present all throughout. But from the posterior part of the testis, this tunica vaginalis goes inside the testis, and it acts as a partition which is called mediastinum testis. Actually that partition, what Sir has given a color, that is the green color, which shows that partition. That partition is nothing which is called the mediastinum testis. It's a partition is coming from the tunica vaginalis and goes up to certain distance within the testicular cavity, that is the mediastinum testis. And from that partition, we can see there are several sub-partitions which are coming towards the anterior part of the testis and divides the testis into several lobes. You can see there are several lobes or lobules. Okay, and these lobules or lobes are pyramidal in shape. We can see the base at the periphery. That is, base is directed anteriorly and apex is directed posteriorly towards the mediastinum. Okay, and within the lobules, what we get? There are some convoluted tubules. In each lobule, we can get 1 to 3 seminiferous tubules. Seminiferous means semen means that is also called seed. So within the seminiferous tubule, we can see the spermatogenesis process. And we have some idea with the help of anatomy, with the help of physiology. There are primary spermatocyte, secondary spermatogonium, primary spermatocyte, secondary spermatocyte, spermatids, and then from spermatids to the zooa, the whole process is called spermatogenesis, which requires 60 days, which is on an average, which is 60 days. And the process is divided into spermatocytosis, and then from spermatid to spermatozoa, that is the spermiogenesis. There are two processes. So within I am not going into the function. Anatomy is related with the structure. Function is related to the physiology. Okay, this is the basic difference between anatomy and physiology. Now, and most inside, and most inside there is another layer, that one is, most inside there is another vascular layer which is called tunica vasculosa, which is lining the lobules of the testis. Okay. Now this, we can see this seminiferous tubules joins behind, and they first they forms the 15 to 30 straight tubules, and those straight tubules joins with each other and forms a network of tubules, which is called reti testis, which is also present within the mediastinum. And from the reti testis, we can see some efferent ductules. Around 12 to 15 efferent ductules comes out, and they are continued above as head of the epididymis. And this head of the epididymis is continued as the body, and the body and the lower part is known as the tail, and the tail is continued as vas deferens. Vas deferens is present posteromedial to the epididymis. Remember, vas deferens is continued posteromedially to the epididymis, and from the upper part of the upper pole of the testis, it joins with other components of spermatic cord. That means testicular artery, testicular veins or pampiniform plexus, testicular nerves, lymphatics, and it forms a thick tubular structure that is called spermatic cord. So that, but the vas deferens is a whip-like muscular structure, and it can be felt with the help of index finger and the thumb at the root of the scrotal sac. We can feel the vas deferens, and there we carry out the vasectomy. In the sub-centers in rural areas, we carry out the vasectomy procedure. Okay, and we can feel the vas deferens at the root of the scrotal sac. Now about the now what is clinical anatomy? That is hydrocele. When there is a collection within that tunica vaginalis, it is called the hydrocele. Okay, you can, and we can, there are several types. I am not going into detail. The infantile type, congenital type, already we have covered during our discussion in the inguinal canal. Okay, remnant of processus vaginalis. Now, ওটা দেখা একবার, এই যেটা ওই আমাদের এই seminiferous tubules. This is the cut section of the testis, where we can find there are several seminiferous tubules, and within the tubules we can see that the different spermatocytes, spermatogonia, actually spermatogenesis is there. From periphery to center, we can find the spermatogonium, then primary spermatocyte, then secondary spermatocytes, and ultimately we get the spermatids. And there are supporting cells which are called the Sertoli cells. And within the cells of Sertoli, actually spermatids borrow their head, and ultimately there is generation of the spermatozoa which is present in the central part, centrally. Okay, and this is being carried out through the epididymis, first through the state tubules, then reticulates, then differentius, then through the epididymis, then through the vas deferens, and ultimately it reaches where it can reach. It reaches up to the ejaculatory duct. Okay, and there is a temporary storage which is called seminiferous tubules. Okay. Now about the arterial supply একটু বলে দিই। This picture shows the testicular artery. They are the direct branches, lateral branches from the abdominal aorta at the level of L3 vertebra. Okay, we have seen in the cadaver, and it passes through the deep ring, it passes through the superficial ring, and it reaches the scrotum, and it supplies the testis. What is the other supply? Artery to the vas. Again, it is coming from the inferior vesical artery, and that is again from the anterior division of the internal iliac artery. So there is an anastomosis between this testicular artery and the artery to the vas. So ultimately when this artery is tied, the testicular artery is tied, what will happen? Testis will not get its blood supply or not? Tell me. If I tie the testicular artery in the abdomen, whether it will get its nutrition or not? Tell me. Yes or no? Yes. By anastomosis between artery to the vas, very good. But if the testicular artery is tied near to the testis, what will happen? There will be no anastomosis. The anastomosis is proximal. Anastomosis is proximally placed. The anastomosis between the artery to the vas and the testis is proximally placed. So it is, if it is tied within the scrotal sac or towards near to the testis, there will be gangrene, development of gangrene. About the testicular vein, and there are other cremasteric artery, that is, I am not going into the detail. And you can see this is the venous drainage of the testis. It is from there are several veins which forms the pampiniform plexus. Okay, it forms the bulk of the spermatic cord. When we are entering through the deep ring, it is 4 in number. When it is entering into the superficial ring, they are 4 in number. When it is entering into the deep ring, they are 2 in number, and they join at any level within the abdomen and forms the testicular vein. On the right side, it drains into the inferior vena cava, and in the left side, it drains into the left renal vein. In the left renal vein, another vein will drain. Which one? Suprarenal vein. Left suprarenal vein. Okay. So, why we are concerned with pampiniform plexus and this testicular vein? Clinically, surgically, it is very important. You will get cases in surgery OPD. That is the varicocele. Varicocele, that means dilatation, elongation and tortuosity of these veins. In the testis, there is a testicular swelling. Patient will come with testicular swelling and he will examine and he will detect there is varicocele. That means dilatation, elongation and tortuosity of these veins. This is called varicosity. And varicose vein is very much common in the left side. Why? The left testicular vein is longer than the right testicular vein. It drains at right angle against the gravity. It passes through the pelvic colon, which very often it is loaded with the fecal matter, and the left testicular vein has least number of valves. Okay, so varicosity. Chalo, very nerves. The nerves are coming. Innervation from the sympathetic, coming from the T10 or T11 level of spinal cord. The sympathetic nerves passes as lesser flankic nerve, then celiac ganglia within the abdomen, then aortico-renal ganglia, that means along the aorta and the renal artery. From there it will go down, it will form a testicular plexus and it will enter and it will supply the testis. So, if there is any pain related to the testis, it will be referred to the umbilicus because same segmental innervation. Umbilicus is also supplied by the T10 segment of the spinal cord, and that one is also by the T10 segment. Okay, so that is sympathetic aortico-renal plexus around the aorta and around the renal arteries. Actually, that greater, lesser and least flankic nerve, you remember, they are very important. They are coming out through the several. One is coming out to the aortic opening, medial arcuate ligament. Can you remember? Already you have forgot everything. It is very natural that you might forget. But repeatedly you have to read. So the lesser flankic nerve, ultimately celiac ganglia, aortico-renal ganglia, testicular plexus, flow chart. If you just give us the flow chart, we will know that you know it. The lymphatic drainage. Lymphatics passes through the spermatic cords, through the testicular artery, and around the testicular artery, it will enter around the aorta to para-aortic lymph nodes. Okay, pre and para-aortic lymph nodes. Okay. Now, testis is generally present within the scrotal sac. This is normal. testis might be absent, anarchism, which is called anarchism. One testis is absent, monarchism. Testis is present but in ectopic area, ectopic testis. That means at the deep ring, at the superficial ring, or within the inguinal canal, or within the abdomen. That is called cryptorchidism. Cryptorchidism. So, cryptorchidism is very important. Early diagnosis. As we diagnose, we have to, in a child, we have to diagnose early, and we have to, surgically, we have to put the testis within the scrotal sac as early as possible. Why? Within the abdominal cavity, we know the spermatogenesis and all process will get hampered. Next, in cryptorchidism, there is chance of seminoma, that is testicular carcinoma will develop. Okay, if it is not corrected, it is not put in the scrotal sac, there will be chance of malignancy, infertility, atrophy. There are so many things. There are some mesonephric duct, paramesonephric duct, you know, Wolffian duct, Mullerian duct, mesonephric tubule. ছেড়ে দিন স্যার, ছেড়ে দিন, এসব বলবেন না, মনে রাখতে পারি না, পরে বুঝিয়ে দেবো, এটা ক্লাস না তো, বুঝিয়ে দেবো, এমন কিছু না, ভেরি ইজি, ভেরি ভেরি ইজি। আচ্ছা, Vas Deferens, you can see it is carried out, already we have mentioned, and it has, what is the length of the Vas Deferens? 45 centimeters. What are the other structures in the body which has got 45 centimeters? The length of the femur in a normal height person. Then length of the spinal cord 45 centimeters. কোথায় যাচ্ছ? তুমিও ওয়াশরুম, জলরুম, তুমি জলরুম আর দুটোই, আচ্ছা আচ্ছা, ঠিক, ভেরি গুড, জল খাবে এবং যাকে। So this is 45 centimeters in length. It starts from it is continued as the tail of the epididymis. It remains posterior medial to the epididymis, then it passes through the scrotal sac, and in the upper pole of the testis, it meets with other structures of the spermatic cords, and it is continued through the superficial ring of the anterior abdominal wall, then deep ring within the fascia transversalis, and from there all other structures get separated. Then it ultimately hooks round the inferior epigastric artery, and it passes through the false pelvis or the greater pelvis, then it passes through the true pelvis. Okay, during its journey, it will cross some structures. Like it will cross the psoas major, it will cross the genitofemoral nerve. Okay, and in the true pelvis, it will cross the structure present in the lateral wall of the pelvis. That means obturator externus muscle, then obturator nerve, artery, vein, it will cross. It will also cross the ureter from the medially. At the, you can see it crosses the ureter. Okay, medially. দেখো ওই পরেরটাতে আছে, you can see these are the ureters, this deferens actually crosses the ureter medially, hooks the ureter medially, and there is a dilatation which is called the ampulla of the vas. Okay, and this joins with the duct of the seminal vesicle, and ultimately we get the ejaculatory duct which opens within the prostatic urethra. Arterial supply, very natural. Within the pelvis, what artery is there? Internal iliac. From the anterior division, we are getting the superior vesicle, inferior vesicle artery. They will supply because they are near to it. Definitely, it will not be supplied by the facial artery. When it is within the abdomen, this is a common sense. It should be supplied by the branches from the internal iliac artery. That is a superior vesical artery, inferior vesical artery. Okay. And ultimately, lymphatic drainage is here we are getting within the external and internal iliac group of lymph nodes and etc. Now this is the histology of vas deferens, very important. Similar histology we can get in case of ureter. You can see outer longitudinal muscle, inner longitudinal muscle, the muscle layer, just try to focus on the muscle layer, the outer longitudinal muscle, inner longitudinal muscle, and in between there is a circular muscle. This pattern is also present in lower ureter. In upper ureter, it is different, it is outer circular and inner longitudinal. But in the lower ureter, you will get outer longitudinal, inner longitudinal and intermediate circular. But how you can differentiate? This is whether it is a ureter or vas deferens. Both are star-shaped. Both are star-shaped. When you will look in the microscope, they are star-shaped. How you can differentiate? The epithelium. Epithelium is pseudo-stratified columnar epithelium. And in case of ureter, we will get urothelium. What is the difference? Regarding you have to look at the mucous membrane. Now, there is a peristaltic movement by which it is carried out from the epididymis to the ejaculatory duct. Chalo, next. Ejaculation. Vasectomy. It is procedure which is carried out. It is a family planning procedure and safe procedure. Very much safe. With respect to tubectomy. Tubectomy, laparoscopic tubectomy, it's a much more invasive. Whereas vasectomy is least invasive. It can be carried out randomly in any sub-center or in the health center. Okay. We have to fill the vas deferens at the root of the scrotal sac with the help of thumb and the index finger. We have to give a nick in the skin. Okay, I have removed the testis and the part of the spermatic cords from the right side of this body. Okay. So similar incision, there is a nick should be given, and we have to reach we have to identify the vas. In case of testis, in between the seminiferous tubules, we can get some interstitial cells of Leydig. They secrete the androgens. Okay, androgens, testosterone, even estrogen. Okay, which helps in spermatogenesis, the testosterone. And interstitial cells are in control of the higher endocrinal gland, that is the pituitary gland, that is anterior pituitary, which secretes interstitial cell stimulating hormone, which is analogous to luteinizing hormone in case of female. Here we can find the epididymis on the lateral side, and here we can find this is the outer layer which is glistening. Okay, that is the tunica vaginalis. Now this is the visceral layer, intimately attached. We have cut the parietal layer. So this is the visceral layer. Okay, and next is the tunica albuginea. Okay, and here we are getting a depression. On this side there is no depression. This depression is called the sinus of the epididymis. Epididymis. Okay, so this sinus of the epididymis. Here we can see this is the blue colored area or black, the pampiniform plexus. So this is the sinus of the epididymis. Sinus of the epididymis remains on the lateral side. So this is the lateral side. So this is the medial side. This is the upper pole. This is the lower pole. Anterior inferior border, posterior superior border. Okay, and we have to hold it with the same hand. Okay. So this is the testis, right testis, and the identifying point is the sinus of the epididymis, which remains laterally. এখানে দেখো কোনো কিছু নেই. It is present only on the lateral side. ঠিক আছে, এইটুকুনি জানা. এইবার যেটা আমাদের আজকে বার করেছি, যেটা we can find, this is urinary bladder. This is the male external genitalia. We can see the scrotal sac and the penis. Okay, we have to hold it like this. So we can find one fossa. There is only one fossa. This is the rectum. So rectovesical pouch. Only one pouch is there. The peritoneum is reflected from here. Is the rectum, which is pelvic colon, junction between pelvic colon and the rectum. It is continued in the lower part. We can find. পরিষ্কার করেনি, ছেলেগুলোকে না নিয়ে আর পারি না। কৌশিক, আমাদের এটাকে এবার কেটে ফেলছি, বুঝেছো? এই অ্যানাল কানালটা আমি এখান দিয়ে কাটছি গো, বুঝেছো? তো পুরো পরিষ্কার করেনি, এই অ্যানাল কানাল পরিষ্কার করেনি। বলো তারপর কাটবো, বলো নাকি? So how we can hold it? This is the urinary bladder. It is the apex, boat shaped area, superior surface, and there are two inferolateral surface. Okay, urinary bladder. Okay, we have to put several fingers like this. Okay, and another finger like this to hold the penis and the scrotum. This is the male external or the male composite viscera. Okay, this left sac is empty, right sac we can get the testis. It was present within this. We have opened. So at the root of the scrotum, we can find the spermatic cord. Here we can find the vas deferens. Okay. এই যে right left বললাম, sinus of the epididymis. It remains on the lateral side. So that this is the sinus টা রয়েছে. এই sinus of the epididymis. ঠিক আছে? বেশ এই জিনিসটা দেখো, ইউরিনারি ব্লাডারটাকে কিন্তু ভালো করে চিনতে হবে তোমাদের। ইউরিনারি ব্লাডার দেখো এপেক্স, দেখেছো? এপেক্স is continued as median umbilical ligament. Okay, this is the superior surface and this is the two inferolateral surface. This is the base. This is the base. This is the base. কি বলো? এই যে ব্লাডার, এটা ঠিক আছে, ব্লাডারটা কাটা। আর দিস ইজ দ্য পাউচ বিটুইন দ্য রেক্টোভেসিকল পাউচ। আর এখানেই আমাদের পস্টেরিয়র সারফেসে আমাদের এই জায়গাটাকে বলি বেস অফ দ্য ব্লাডার, এটা ঠিক আছে। বেস অফ দ্য ব্লাডারেই আমাদের উই ক্যান গেট দ্য সেমিনাল ভেসিকল। এই যে দুটো সেমিনাল ভেসিকল দেখতে পাচ্ছি, এই যে এখানে একটা, কোনটা স্যার? সেমিনাল ভেসিকলস। এই এখানে একটা, এখানে একটা সেমিনাল ভেসিকল। Base of the bladder. Okay, this is the bladder, urinary bladder, the peritoneum. Okay, এটাও আছে। এই দেখো ইউরেটার অফ ওয়ান সাইড, এইদিকের ইউরেটারটা কাটা গেছে ব্লাডার, ঠিক আছে, এদিকে ইউরেটার কাটা গেছে রিমুভালের সময়। এই দেখো, এই দেখো ইউরেটার উইথ দ্য ইউরেটার। ওকে, এটা পেরিটোনিয়াল পার্ট, পেরিটোনিয়াম। পেরিটোনিয়াম তো এদিকে ল্যাটারাল পেলভিক ওয়ালের দিকে গেছে, and we are getting the ureter, one sided ureter.